I just want to say thanks for taking time out of your busy schedule, Dr. Mattingly, for getting on the call and doing this webinar with us.
Absolutely.
We know you were busy, not just in the ER, but you're a family woman. You've got a couple kids. Where are you coming to us from right now?
Right now, I'm coming to you from Chicago. I'm right on the outskirts of downtown. I'll give you guys a brief little view here, just in case you're stuck in the house.
Yeah, so coming from a high rise in downtown Chicago where
Yep.
this is a real concern. So you're on the front lines, and you're, like most people too, just a person taking care of their family. I think right before you got on this call, you had to get the kids taken care of and out of the house. So you had a few minutes to try to pull this off with me. I'm doing the same. My kids are stuck in the basement right now. So I have a few minutes to try to clear this out with you. But, I kind of want to talk a little bit about your experience and your credentials. You're board certified emergency medicine. You've been actively practicing for 12 years. You completed your residency at University of Chicago. Before coming into Chicago, you did mission work all around the world. I remember you telling me a story recently about how you had even been dropped out of a helicopter to save somebody's life before. Is that true story, or is that all made up?
No, I actually, in residency, as part of the residency training, we were part of the helicopter crew that would fly usually across Lake Michigan, either to the state of Michigan or to Indiana or deep into parts of Illinois where people needed to get to Chicago to get specialty care. So I've picked up and flown many people in the helicopter before.
So, point being, you've seen just about everything, have you not? Because you've practiced in busy ERs downtown, but you've also been in rural, you've been around the world, you dropped out of helicopters. Am I missing anything?
No, in my career, I think I've seen a pretty good gamut of what can present itself. So yeah, pretty extensive.
Yeah, and I can speak to you personally. My personal relationship with you, you're very down to earth, good, caring, natured person. So, I think it's valuable to have somebody like you be available to speak to the public because the media, has their own spin on a lot of things. So I thought it was awesome to be able to get the story from the inside. On top of all those other things, you're also board certified in obesity medicine. You've oversee 7 outpatient clinics currently, I believe.
Yep.
So, I mean, that really, makes it feel like you're on the front line from both ends, right? You're trying to save people's lives on the back end, but also on the front end, you're looking at trying to help a person's health. And it's one of your focuses in helping people so you don't have to see them in the ER.
Exactly.
And I think that's a big part of why we're doing this today. In a time of crisis, a lot of people are very concerned about going into the ER and the shortage of supplies and, what's happening in the ER. I had a couple questions that we've seen. I think the focus is obviously coronavirus, but it's also been called COVID-19. What's the difference for the layperson out there?
So the coronavirus is actually pretty common. There are lots of different forms of coronavirus. Some of the ones you all may have heard of that recently caused epidemics were the MERS and the SARS, which is the severe acute respiratory syndrome. But the coronavirus is actually one of them is responsible for just causing the common cold. So the difference now is that we've got this new coronavirus that has jumped from a mammalian species into a human species. A coronavirus gets its name because it has spikes on it, which makes it look like a crown. And so that's how it gets its name. The 19 part comes from 2019. So this is novel coronavirus 2019, which causes the severe acute respiratory syndrome. So coronavirus is all around us. We've all had it when we had a runny nose before, but this is a new one that jumped into our species from mammals. And so we have no natural immunity to it or any experience with any vaccines or even how to deal with it.
And that's why it's, a real threat and is spreading the way it is, correct?
Exactly. Yes.
What do you think? I know we have conversations regularly and you give me facts that I haven't heard of. And I feel like we're all stuck at home. I'm watching the media constantly. I feel like I'm pretty intelligent and up to date on things. And you always know something that I don't know. So maybe could you share maybe like your top 5 most relevant facts right now that maybe somebody hasn't heard?
Sure. First of all, let's go over the quick numbers this morning because these numbers change by the hour. So I got them written down here. So as of this morning in the U.S., we had 59,966 cases with 101 deaths, and globally we had 433,172 cases. So that's where we are this morning. Something really, really interesting about this particular virus is it took us 3 months to reach the first 100,000 cases. It took us 12 days to get to 200,000, and it took us 3 to 4 days to get to 300,000. Now we're up over 400,000 in just a matter of days as well. So we are in what's called the acceleration phase. There's an initiation phase where the virus first presents itself, and you have mostly like travelers from outside bringing it in, and then the acceleration phase is when you start to see community spread amongst ourselves. So that's the phase that we're in right now.
And that's what we're seeing in our major cities, right?
Exactly. Do
you think some of the acceleration in numbers has to do with increased testing and the rollout of testing, and maybe that's going to cause some spiking?
I personally feel like the number of coronavirus positive people is probably 2 to 3 times what's being reported, because if you're mildly symptomatic or asymptomatic, you're just told to stay at home and you're not getting tested. The testing supply is so limited that we're only able to either test the sickest people or who are usually the ones that are coming into the hospital.
Gotcha. I didn't mean to cut you off.
Oh, no, that's okay. I was just going to say, the data coming in now is saying that we are still, and this is based off of what we've seen in China and Italy, the data coming in now saying that we're still at least 6 to 8 weeks out from the peak of the virus.
Yeah, I mean, that's pretty critical information for what's out there.
Mm-hmm.
We hear reports on the media that, it might be a few weeks before people go back to work, or, the non-essential businesses go back to work. And, I know there's probably some mixed feelings on that from what you're hearing on the inside, whether it happens or not. It doesn't mean that the slowdown is occurring anytime soon based on what you're hearing on the inside.
Exactly.
Inside the hospitals. Where are you getting your reporting from? Like, I assume the hospitals have some, group meetings and stuff, and you get some inside reporting that way.
So my email and my text messages are bombarded literally hour by hour. So yes, every morning we get hospital briefings from the different hospitals I work in. Of course, I check CDC and WHO. I have a couple of WhatsApp and Facebook groups where we literally just disseminate information or experiences of what we are seeing day to day that's not being reported yet. And then I actually got a message recently from someone who was at the critical care conference in Italy when the reports were first coming out of what to expect. So I have information from a couple of different sources, some of them official and some of them non-official, when we're just speaking amongst ourselves about what we're seeing.
Okay, so I think there are people out there that are kind of like in disbelief still, right? That this is real. Have you had experience with a COVID-19 patient personally? And do you know people that are infected with it? Do you have any colleagues that are dealing with this?
Yes, we actually have several emergency medicine colleagues that have been affected by the virus. We have a couple in critical condition currently on different coasts, West Coast, East Coast. Every patient that comes in, we have to assume that if they have any kind of respiratory symptoms that we can possibly be exposed. We don't have a confirmed case at my particular hospital yet. We do at all of our neighboring hospitals, but I also think it's only a matter of time. And as we increase testing, also, it's only a matter of time.
Right.
Remember, we're 68 weeks out from the peak. That's still a long time.
Where do you think that the 6 to 8 weeks came from? Is that modeled out? You think we have enough data now to know that?
Well, I think it comes from epidemiological patterns from previous disease outbreaks that we've seen worldwide throughout history. And then I think also it's coming from the data that we've seen so far in Italy and China. China just within this last week finally started seeing a decrease in their number of daily cases. So I think a lot of it is modeled off of that.
Right. And they did like a complete shutdown, and they're about 3 months out now?
Yeah, at least December. I think December was their first case.
Were there any other relevant statistical facts that you want to talk about before I cut you off there? I know you had some notes that you were looking at.
You all have some really, really good questions. So I could talk statistics all day. I could, but I think most importantly, I just want to get your questions answered. I think the most important things I talked about are when it's going to peak, and don't assume that this is a virus that you cannot contract even if you're young and healthy. We are seeing that amongst children, obviously the virus has not been as virulent, meaning it's not been as severe. It seems to be that infants are more in the child population. Infants are more at risk than toddlers and children. And then, of course, you've all seen the stats on TV. As you get up over 65 and then 85, your risk of complications and mortality increases significantly. So,
right.
I'm sorry, but not to take anything for granted. We have actually seen now coming out of Italy, even people in the age 20 to 30, 20 to 40 age range, 50% of them are severely ill. So
yeah, so people are getting sick from this.
Absolutely. More sick than we actually originally intended. And I think it's because we have more data and we have better dissemination of information from our colleagues in Europe that's coming out now.
So one of our main focus of this whole thing is to try to help keep pressure off the hospital system, right? Because that's the big worry and the overwhelm that there's going to be a collapse in our medical system. So what are the top 5 things that people can do to slow the spread and keep pressure off? Rachel asked us specifically, outside of social distancing and washing hands, are there things that we can do to further protect ourselves personally, supplements to boost immune system, etc.? So this is a question from Rachel in the feed right now.
The first thing is to just keep yourself healthy, obviously. Take your vitamins. The hand washing, the reason we do 20 seconds is because 20 seconds is how long it takes to disrupt the capsule of the coronavirus. So really just plain old hand soap, and not antibacterial, because this is a virus, it's not a bacteria. Any hand soap for 20 seconds is enough to disrupt the capsule and kill the virus. I personally carry a little bottle of hand sanitizer in my purse and in my jacket right now. I use it all times of the day. The social distancing is really, really important. What I think people need to recognize is that I'm on the front lines in the ER. I have to be there. I have to take whoever comes in. But the moment you step foot outside of your home, you are on the front lines as well. And that's how you have to think about it. That's how you have to think about protecting yourself. Any person that you come into close contact with or surfaces that you touch, you can contract the virus. So think of yourself when you go out there outside your home, you are definitely on the front line. So just remember that and protect yourself accordingly.
Yeah.
Other than that, it's the usual stuff that you've heard. Cover your mouth and cough into your elbow, which keeps you from getting in your hands, which then spreads. If you have to cough or sneeze into your hands, use a tissue and then wash immediately afterwards. The virus enters through mucous membranes. So that's when you inhale the droplets from somebody that has coughed or sneezed, or you touch your eyes or your nose, it gets in that way. That's why they say 6 feet is the minimum distance you need to keep, because if you cough or sneeze, your droplets are not likely to travel further than 6 feet.
6 feet.
Yeah.
So there's a relevant question in the feed right now that pertains to that. Michael asks, how long does the virus droplet survive in the air?
Okay, so from what we're hearing now is the respiratory virus is not airborne, just in regular people coughing and sneezing. It's just droplets, meaning the drop has to touch you, and then that's how you contract it. Or the drop has to land in your nose or in your mouth when someone coughs or sneezes. We're only seeing possible airborne transmission in our hospital settings where somebody is like using nebulizer treatments or getting a procedure done where they're spewing a lot of the virus out into the air. But usually just out in our everyday interactions, it's droplet transmission.
So like the droplet actually has to touch you. It's not like it's just hanging out in the air for any period of time.
Yeah, exactly. Unless you're in a hospital doing a procedure where it's making someone gag and cough repeatedly, spewing it in the air. No, just in the regular general public, it's droplet transmission, and it has to come in contact with your face or your mucous membranes.
So why do you think the spread rate's so high? They're saying that this has a 45 time contagion versus like a flu has a 9-time contagion, or it's 3 to 5 times more likely to spread. Mm-hmm. What do you think that is? Because there's this concern over it being airborne.
Mm-hmm. So here's the thing about it. I think that, all the data is preliminary. We're still learning about it day by day. I wouldn't be surprised if in a few weeks, someone says, oh, there may be a component of airborne transmission. We just really don't know. I think it's spreading so quickly because you've got this stealth transmission going on, which is the people who are mildly symptomatic and asymptomatic are passing it.
Right. So you don't even know you don't even know.
Correct. And the incubation period for this disease is longer. So flu, you're around somebody with flu, within like 2 or 3 days, you're feeling very flu-like, you've got the flu. Coronavirus, the average incubation period is around 5 days, but it's up to 14 days, which is why you're going places and they're saying if you've been traveled internationally, you cannot come to our office if you've traveled internationally in the past 14 days. So during that 14 days, you've had contact possibly with hundreds and hundreds of people. So the incubation period being so long, I think is what's also causing such a rapid acceleration amongst ourselves. We just don't know for 2 weeks that we're even carrying the virus.
And difficulty modeling and analyzing the data that's come out because it's so in.
Yes, because it changes hour by hour.
Right. So a couple other questions. Michael asked follow-up, can the virus only survive in certain temperatures? And then John asked, how long does it live on surfaces after the droplet hits a surface?
Yes, good questions. Okay, so it's not a very heat stable virus. So it's killed at temperatures of, I believe it was 149 degrees Fahrenheit, if I remember correctly. So washing your clothes in really, really hot water will obviously, if you can get your washing machine that high, will kill the virus. In terms of surfaces, it survives on cardboard for 24 hours, metal for 48 hours, and plastic for 72 hours. So if you've got your packages coming in, I know for a fact when I've had stuff delivered, if it's in a cardboard box, I just shuttle it to the side and we wait and we open it the next day. But you could probably wipe your stuff down. If you have to take your kids to the playground, if they don't want to go for a walk, if they just want to go to the playground, just make sure that you either wipe down what they're on or wipe them down immediately with, hand sanitizer or wipes afterwards.
Are you taking your kids to the playground right now?
So we have taken our kids to the playground once when there weren't a lot of other kids on the playground, but otherwise right now we're opting for walks and we're opting for parks that don't have a lot of equipment that you can touch. We're opting for parks with like rocks and a lot of grass and some hills that they can run up and down personally.
So one thing earlier, you talked about the alcohol and the hand sanitizer. Mm-hmm. I know in the past you've said there's a certain percentage of alcohol needed to make it effective. Mm-hmm. Is that correct?
Yeah, you need to shoot for anything with 60%. 60 to 65% and higher is what you need to kill the virus.
Yeah, I think that's good to know that not common knowledge necessarily. What's your thought on telemedicine and e-visits and screening people that way to help take some pressure off the hospital systems?
I think that what separates this pandemic from other pandemics is that we have this technology available now. 100 years ago, even 10 or 15 years ago, when we had like H1N1 and these other pandemics going around the globe, we didn't have the availability of connecting as readily available globally or even with our doctor's office right across town. So I think that that's actually going to help decrease the spread of transmission. I think it's right on time. And I would encourage anybody to definitely utilize it if it's available, if you are feeling symptomatic, or even just for routine visits that have nothing to do with coronavirus at this time.
Is it something you see yourself offering in the future?
Oh yeah, absolutely. It's pretty easy for me to just hop on and talk to folks, even if it's just for reassurance. A lot of times I feel like people don't honestly have severe symptoms or they're not displaying an actual symptoms of a problem, but they just need some reassurance and they need to know specifically for them what they need to look out for. So for you,
we've talked about this in the past. If 10 people came into the ER, how many of those people do you think really needed to come to the ER on average?
So we have this term in emergency medicine called the worried well. So there are people that have read the conspiracy theories, they're doctor Googling away at home. And, if you get on some of these medical websites, they will convince you that you are dying. So we have a huge percentage of those people that come in. Probably for every one of those I see, for every 10 of those I see, I will say probably for every 20 of those I see, there's about 1 or 2 that actually legitimately need to be there or need to be hospitalized or treated.
Right. And that's a concern for me. I've just looked at this from an outsider's perspective and efficiency. And that's taking time from you potentially saving those 1 or 2 people that come in their lives, because time matters when it gets down to it and you're in an emergency situation. Mm-hmm. I want to move on to PPE. What is PPE, and is PPE shortage a real thing? Are you starting to see that in the ER yourself? I guess just go into that a little bit for us.
So PPE stands for personal protective equipment, and there are different levels of it. There's your basic face mask, which you see a lot of people wearing out here in the general public, and then there are more secured forms of respiratory devices or gowns that don't allow the permeation of particles. N95 is the perfect example. It filters out 95% of particles, and especially large particles that can get through to your respiratory system. The shortage is absolutely real. We have discussions every day about how do we reuse our mask. I personally go in every shift. I grab my mask. Matter of fact, we didn't have any N95 mask on my last shift, and a paramedic happened to have a couple extras, and I got mine from a paramedic. I write my initials on it. I put it in a bag, and I have labeled it Dr. Cam's COVID kit, so nobody knows to mess with mine, and it's got my goggles in it, and I have to reuse that for my entire 24-hour shift. We are very short, especially in the outpatient settings. At one of our clinics recently, we waited 2 weeks to get any mask for our staff. So the personal protective equipment is absolutely essential. If somebody comes in with respiratory systems, we have to gown up and be covered from head to toe, bonnets, goggles, mask, and gowns and gloves.
Yeah, I mean, you basically look like you're in a hazmat suit. I've seen a picture of you.
Yes, and imagine this. Imagine we have to change that out for every single patient. So you can see how quickly we would go through all of our resources.
Right.
And one of the reasons why we're so short on equipment right now, and people may not know this, is because a lot of the factories in China were shut down because of coronavirus. And a lot of our supply comes in from China. So now that the Chinese curve is starting to go down, the Chinese are starting to open up some of their factories. And so hopefully we'll have more equipment readily available these days.
Right. This is a world protective equipment
Absolutely.
shortage, not just a national. Question we just had is, if you think that you have COVID-19 and you become sick, when should you consider going to the ER? Is there a specific symptom that they should be looking for?
Yes. So the main symptom you should be looking for is if you're having respiratory difficulty, if you're having wheezing, coughing to the point where you're losing your breath, feeling you're going to pass out, you're getting dizzy, then you definitely need to head in. We're now also getting reports of gastrointestinal symptoms, so people with severe vomiting and diarrhea. So if you're feeling dehydrated, then you definitely need to go in as well. Like I said, the symptom list is evolving, so we may come up with something else later. But if you're mildly symptomatic or have little to no symptoms, then you should just call your doctor or use a telemedicine service to figure out what you should do.
Yeah, you had mentioned right now that people are getting screened for flu prior to COVID, and there was a pretty high percentage there. Could you go into that a little bit? And, what does somebody need to get a flu test and a COVID test? They have to be doctor scripted, correct?
Yes.
Okay.
Yeah, you have to have an order. So interestingly enough, what we are not seeing is a lot of co-infection of flu and coronavirus. So when you first come in, you've got your fever, you've got your cough, everybody gets tested for flu first. If your flu is positive, we are 96, 97% sure that you have got the flu and it's not coronavirus, and then you can go home. Only after you have tested negative for flu and the suspicion remains high for coronavirus, will then you then get tested for coronavirus. But the incidence, last week it was like 99%. The incidence of people having coronavirus and flu concurrently is extremely, extremely unlikely. So I know nobody wants to have the flu, but if you've got the flu right now, then that's actually a little bit reassuring, because then it means you likely don't have coronavirus.
Yeah, I had the flu 4 weeks ago, and I felt like all the symptoms I'm reading, what I'm seeing online, what I'm seeing on TV, I had the exact same symptoms that everybody talked about. I went, first time in my life I ever got flu tested or screened, swabbed up the nose, which is not comfortable at all. And I was positive flu A, and in my mind, I'm thinking, is it possible that I had COVID at the same time? And you telling me that was a huge relief. And I think a lot of people out there are just thinking, I need to go run and get tested for coronavirus right now, right? Mm-hmm. But the preliminary is you need to go get tested for flu A if you have any
Absolutely,
symptoms.
yes, first, yes.
Or flu B, but flu A is the main one right now, is it not?
Yeah, this season we saw flu B early on, and now we're starting to see our flu A's. But you can have either one.
where are we at as far as the curve of flu that you see right now? Are you still seeing a consistent number of flu patients
Yep.
coming in the ER?
And I've been relieved
So,
myself, actually, because they're coming in. You don't know what they have when they come in. And every time they have flu, I'm like, great,
yeah.
dodged another bullet.
I can only imagine the way you feel. I mean, you're a real hero on the front line.
Thank you.
I want to do a couple of takeaways, and then let's jump into some of the questions that were online the other day. I just wanted to say my top takeaway was that flu test versus COVID test and the 96% reassurance that you got flu A, which, how long does it take to get screened for flu A? Like, it's 5-10 minutes, right? You
Oh,
can
yeah.
find out
Flu A is done in the office. We have results like 30, 45 minutes, an hour tops, maybe. It's a rapid flu test. So that's pretty easy.
So that was my number one takeaway, is differentiating the two in the prior, the order in which they need to occur. Did you have a takeaway that you wanted to talk about at all before we move on to answer maybe some more questions?
My takeaway is just to consider the threat very real. That's pretty much it. I mean, the majority of us, if we catch it, we'll do okay. But what we have to do is look out mostly for our people who won't fare so well, our older folks, our immunocompromised folks, our folks with underlying, diseases. So, and
I always like to.
The number one thing that has right now the determining factor of how people are going to do with, other than age, in terms of comorbidities, is what we're finding is, underlying lung disease definitely makes you at risk for complications, but heart disease has actually been the biggest factor in how people are going to fare if they're sick enough to be hospitalized at this point.
So one of the questions I missed here is, and maybe it's relative to what you just talked about with heart disease. There's been some, I don't know if you would call it research or studies out there that says if your heart rate increases, and you take that consistently on a daily basis and you see it increase, that there's indication that you're becoming sick. Do you, I guess, what's your take on that? If you've read that your resting heart rate increases days before coming ill, is that something to be helpful to look for?
Well, you can look for it, but it's actually very non-specific. It's sensitive, but not very specific, because your heart rate increases with exercise, with exertion. But yes, it definitely increases when you get fever, when you get dehydrated, or when you're becoming ill. We call it tachycardia, which is usually a heart rate over 100.
Yeah. So probably more important, if somebody's trying to identify, where they're at in sickness, taking the temperature would probably be more appropriate, right? Because that's one of our surveys coming into an outpatient clinic. You got to have, everybody gets, or, the intention is that people get tested for their temperature to see if they have a fever or not.
Chances are, if you've got a fever, you're going to have tachycardia as well, heart rate greater than 100.
Okay.
Yeah, not always, but very, very high probability. And for coronavirus, let me say, so coronavirus is a lower respiratory illness, right? So upper respiratory illness is there's a marker in your throat called your epiglottis. It separates like your vocal cords with your windpipe down to your lungs up from the top part. Your sinus is the back of your throat. So mostly upper respiratory systems, if you've got a runny nose, if you're feeling foggy, like you've got, sinus congestion, ear pressure, that's usually an upper respiratory infection or runny nose, and that's likely not coronavirus. What we're seeing with coronavirus is lower respiratory. So we're seeing a severe, progressive, or persistent cough with pain in the chest and difficulty breathing, like an unremitting, progressing cough. And most times it's a dry cough, meaning it's not a lot of phlegm. As the disease progresses, though, you can start to build up some phlegm, but it's mostly lower respiratory, not upper respiratory. So that might help someone feel reassured who's got a headache right now.
That's a tremendous value add right there, as far as information and what to look for inside of yourself, so we can all become a little more self-sufficient. Before we jump in the Q&A, what is good is going to come from all of this? I always want to know what the positives are.
Well, there's a couple of things. Number one, I think that we will build some sense of immunity in the global population in case we're ever faced with this again. And that should also help the numbers to decrease. Someone had asked about re-exposure, and once we were done with social distancing and everybody could go back out and live their daily lives, would we see a resurgence? And the answer to that question is that if the virus mutates, we could see a resurgence, but I don't feel like it would be as severe since we have now started building up immunity to different parts of the virus. So I think that's the main thing. The second thing is, I think it's been quite, I know maybe some of you are going a little stir crazy. You've got your kids in the house. You're all like working out of like just a couple rooms. I live in a small condo in Chicago. We're literally on top of each other. But it helps kind of like bond, build family time. It helps, increase your endorphins. If you're not stressed out, if you're taking advantage of this, it helps build endorphins, and it helps build a global sense of community. So at 8 o'clock, I know every night here at 8 o'clock in Chicago, everybody goes out onto their balcony and waves their cell phones, flicks their lights, kind of says hello. I know some of you have seen the videos coming out of Italy with everyone singing. It's very beautiful to watch. So those are some of the positive things that have come out of this. We're all in it together, basically, around the world.
I'm right there with you. I think that's awesome. And the bonding piece is something we're experiencing too here locally. And I see people, everybody is so friendly. I tell you that, as far as waving and smiling and keeping, their head up.
Yeah,
I also
it's like
think
this unspoken understanding, right? From 6 feet away,
right.
from 6 feet away.
Yeah. I also think that there's going to be the tremendous increased awareness on taking care of yourself, right?
Mm-hmm.
And improving your health right now and not just letting it slide, because, this is going to continue on. People are going to get this disease. It's how well they're going to be able to fight it off over the next year, 18 months, as people build immunity or a vaccine comes out or medications or whatever.
Right.
So right now, more than ever, exercise, diet, having a positive mental approach and gratitude to everything that you have in life is critical, in my opinion.
And forcing people who we normally wouldn't be able to reach to find outlets to reach us. For instance, like the telemedicine.
Yep.
If you live in a rural area, I've worked in some areas where there isn't another doctor around for 3 hours, and now they've got to get on their phones. They've got to get on their computers and say, you know what, I need to reach a doctor. So it's kind of forced people to kind of adapt, this global, telemedicine, telehealth, e-visit, culture that we're building. And so as a result, in the future, when something happens, people have more and better access now that they've been kind of forced under the circumstances to utilize these outlets.
Yep. I'm right there with you. Michael just asked, is the 6 foot distance between each other legitimate? I think you answered that already.
Yeah, that goes back to the respiratory droplets. So yes, for sure.
Yeah. Dale asked, how long do you think this quarantine will go on?
Well, like I said before,
we're about shelter in place, or right?
Well, I think that remains to be seen. We're 6 to 8 weeks out from the peak, so the 2-week quarantine that we have right now, I believe, is going to be extended as we start to see the cases accelerate. All in all, global pandemics, or at least this one, has been projected to last 12 to 18 months before it just completely.
Sorry, we took you a little over, but it's been very valuable information that we're very grateful for you getting on here.
Yeah, not a problem. No, you guys gave great information. I think what's most important is not to spread misinformation. It's, the way to keep yourself from getting this is the tried and true. We've hammered that multiple times over. Protect yourselves out there on the front lines. And if you all, need a little extra guidance, call your state hotline, check the CDC or the WHO, and then we're going to be hopefully here having an outlet or a way for you to reach me or others if you have some personal questions based off of your personal symptoms and needs some direct advice.
Through telemedicine, right?
Yes, absolutely. Yes, telemedicine.
Awesome. All right. Well, thank you so much for sharing your inside knowledge, and we truly appreciate the work you're doing on the front line. And until next time, maybe we'll do this again here in a week or so, because information's changing daily.
Yes, absolutely. I'm more than happy to. Thanks for the opportunity.
All right.
All right.
Thank you, Dr. Mattingly.
Thanks, everyone. All right. Bye-bye.